Hello, I'm Bill Patten, Interim CEO here at Rehoboth McKinley Christian Healthcare Services. I want to give you a report from the most recent board meeting, the April board meeting. The board opened, as it normally does, reviewing minutes from other committees. So they received reports from the Board Quality Committee, from the Medical Executive Committee, from the Medical Staff Credentials Committee. They didn't receive minutes from the Finance Committee because the April Finance Committee meeting was canceled. We had scheduling conflicts, and also we didn't have complete financial statements to review. So no report from the Finance Committee. As part of my report, I'll give you a quick update on some of the numbers though. And then as it relates to human resources, Rebecca Martell, our Chief Human Resources Officer, gave a great report about the progress that we're making in hiring staff. An example would be next week in our new employee orientation, we have 7 employees that will be oriented, 4 of which are former employees. That's a trend that we're seeing more and more, where people that have left us over the last couple of years have realized that the grass isn't greener, realized that they really did enjoy working here at Rehoboth McKinley, and they're coming back home. So we're glad to have them, but great progress hiring, especially nurses. HR and Shan, our Assistant Chief Nursing Officer, have really been doing good work hiring nurses. Many of them local, some of them graduates from the local campus of the University of New Mexico. So we are doing a great job. Our overall vacancy rate right now is somewhere in the 13 to 15% range, very good for a small hospital of our size. And the other thing that we're making progress on is reducing the number of traveling staff. We love travelers. They fill a very important role, but they're very expensive for us. And we would much rather have permanent employees. So as part of the overall recruitment progress we're making, we're able to reduce the footprint of travelers here at Rehoboth McKinley. As part of my report, I gave the board an update regarding the planned support we were developing for Gallup Indian Medical Center, their water repair issue. I'm sure you've seen in their press releases that they had a main water supply repair that needed to be done, and it caused much of their building to need to be vacated. We were happy to be able to offer support. We actually cleared out 2 vacant units, nursing units, that we were able to provide to them. Happy to report, this is after the fact, after the board meeting, but those repairs went very well with the support we were able to provide, as well as the sister IHS hospitals in the area. Patient care was not compromised. As I say, the repairs went well, and in less than 48 hours, all of the patients had been able to be returned back to the GMIC campus. So we were happy to play a part in that. We were glad that they reached out and let us help them. So good news on that front. There were a number of medical staff updates that I provided to the board. We have completed negotiations with US Renal, the company that we use to provide inpatient dialysis services. During the pandemic, the rates that we were being charged had increased significantly because of the cost of labor. Now that the pandemic is behind us and the labor costs have been reduced, it was appropriate to revisit the charges, and I've been able to successfully negotiate new rates, so we won't have to make a change as far as our inpatient dialysis provider. We'll be able to continue to provide that important service, but with some more appropriate pricing along the way. Reported that we have lost a couple of doctors. I think I've mentioned this in previous reports. Dr. Spiva is going from us over to GIMC. Dr. and Mrs. Schaefer have given notice they are going to practice south of us. I believe it's with a clinic associated with one of the Zuni healthcare organizations. So sorry to lose some docs, but happy to report we're making progress hiring new docs. We have successfully signed Dr. Chris Gonzaga and Dr. Flor Gonzaga They'll be starting toward the end of May. We're excited to have them both back. Dr. Chris will be doing internal medicine and infectious disease work, and Dr. Floor will be doing sleep medicine, so we'll be able to get our sleep medicine lab open again. So very excited on that. And then we're also looking at the possibility of adding a third general surgeon. We're doing some of the numbers to make sure that we can justify it from a cost perspective. But when you have a 24-hour call responsibility, it's hard to do that with only 2 doctors. And so we're looking at whether we can add a third doctor or whether we should add a surgical PA to assist our general surgeons. I'll keep you posted as those projects move forward. And then the last topic related to the medical staff, I have a meeting scheduled with doctors on the 13th of May. I want to have a conversation with them about what I call a medical needs assessment. We need to be thinking to the future of what specialties and what number of doctors we need to be recruiting. I have some pretty specific ideas, but I'm not representative of what the needs of the community are, the medical staff is. So we're going to have a conversation over a lunch hour to talk about their ideas of what doctors we need to recruit next year, 2 years from now, 3 years from now, so that we can have an organized plan and we can make sure that we get the doctors here that we need. Also reported to the board on the approval that the county recently made to continue the payroll support program. As I've reported in other videos, both the city and the county had stepped forward and had provided almost $4 million in payroll support from the end of December through the middle of February. True to his word, Senator Munoz worked with the state to get a total of $12 million in payroll support included in House Bill 2. That has now been signed by the governor. So it's not a question of if the county and the city are going to get repaid, it's just a question of when and how. So the county approved another $2 million in payroll support for us. What that allows us to do is when we get money from the city or the county, we're able to then use our own money to reduce some of our accounts payable bills. I made a presentation to the city asking them to do another $2 million. So that would take us up to $8 million of the $12 million that has been appropriated. On the appropriations front, we are still waiting to hear from the state how we need to apply for the $15 million debt reduction payment that is available to us. So we need to know how to apply and when those dollars will become available to us. But I'm happy to report that with the almost $4 million in support we've already received from the city and the county, and then a special $1.8 million payment we received back at the end of November, we've been able to reduce our accounts payable by a little bit over $9 million through the end of March. That includes about $2 million in accounts payable that we've been able to negotiate down from the owed amount to a settlement. So we were able to save about 50 cents, approximately 48 to 50 cents on the dollar. And then we've been able to contribute some of our own cash, about $1.5 million toward that effort because of the enhanced collections due under our new critical access status. So while we're not out of the woods, I joke with the employees, we're not out of the woods, but I can clearly show you the path that will get us out of the woods. And once again, a huge thank you to Senator Munoz, Representative Lundstrom, Representative Johnson, the leadership at the county, at the city. Without their help, this path would never have been available to us. So still a lot of work to be done, but happy to report on the progress that we're making so far. So we have completed our combination of our intensive care unit and our medical surgical unit. If you'll remember from previous reports, this was an effort for us to be able to more efficiently cross our staff from one unit to the other based upon acuity and patient load. So we've been doing that now for a couple of weeks. Normal new process, bumps in the road, but overall, this is going to be a much more efficient process for us, allow us to continue to provide a similar level of care, but now in a more efficient manner. We also are working really hard to get a new biomed service in-house. We've signed the contract. We've gone without biomed for far too long. So we have a new company that's starting June the 1st. They have had a tech in here to do some emergent work related to the ICU med-surg combination for a week. We have a tech coming in again next week to do some more emergent things, do some repair of ventilators and IV pumps, but the full service for biomed will start 1st of June. We'll be excited to have that new capability in-house. Happy to report that we have admitted our first 2 patients to our new swing bed status program. As I've mentioned before, swing bed you can think of as nursing home care in a hospital. This is short-term care. It's when a patient needs a week, maybe a little bit more, continued care. They're not quite ready to go home, but they really don't need full-blown hospital care. That's what the swing bed status is all about. After we get 6 patients, then we will be surveyed, and once we're surveyed and certified, then we'll be marketing this program to other hospitals in the area, especially from Albuquerque. As they work to reduce their census, our swing bed program will be a great opportunity to get local people back local until they're ready to go home. And then the board agreed with an idea that I suggested. We're going to do Department of the Month presentations to the board. This is where a department will come to the board and will describe the services that they provide, introduce the staff that covers the department, talk about their equipment, their space, any issues that they have. It's a way to really get the board updated at the department level of the services that we provide and the people that do that. So the first presentation will happen in May of this year. I met with a couple of local faith leaders. We're exploring the idea of creating a volunteer chaplaincy program. Excited about that possibility. Most small hospitals our size don't have paid chaplains, but they do have volunteer programs. So I'm excited to work with these 2 gentlemen and develop with the other faith leaders in our community a program that we can provide support not only for our patients, but for our employees. During traumatic events, our employees need support. They need someone to be able to talk to. Volunteer chaplaincy program is one way that we can help make that happen. We're also, we've just begun training all of our employees in a new program. The acronym is AIDIT: Acknowledge, Introduce, Duration, Explanation, and Thanks. It's a proven way to change how we communicate with our patients, to reduce their anxiety and improve their compliance with healthcare related instructions. So we're training all of our employees. We're having sessions of 20, 25 employees at a time. Happy to report that the initial feedback from our employees is very positive. They like this training and they're actually asking for more training. So excited. This is part of our initiative to provide better service. We're always interested in providing high quality care, but we also want to provide great service. It's like at a restaurant. You want good food, but you want your waiter to be attentive as well. So the same thing that we're trying to do here. The board then went into executive session to discuss a number of confidential personnel matters. They also discussed issues related to real estate and issues related to contracts and leases. Hope you found this report useful. As always, don't hesitate to give me a call if I can provide additional information. Thank you.